Okay, let's dive right into this explainer. Today, we're taking a really close, compassionate look at one of the most emotionally exhausting, but also highly practical realities of caring for someone with dementia. We are going to explore this whole phenomenon of repetitive questioning. We'll unpack the fascinating and, yes, sometimes heartbreaking science behind why it actually happens, and then we're going to arm you with some real, actionable strategies to handle it. So, whether you're a full-time caregiver, a family member, or a professional, the goal here is to completely shift your perspective and give you some practical tools to make your days just a little bit easier.
Have you finished your homework? Have you finished your homework? Have you finished your homework?
Look, if you've ever listened to music on a classic vinyl record, you know exactly what happens when the needle hits a speck of dust or a tiny scratch. It skips, it gets stuck, you hear the exact same 3 seconds of a song over and over and over again until somebody physically fixes the problem. Well, in Alzheimer's disease and other forms of dementia, memory blips create a highly similar effect. You know, you could be having this wonderful, totally normal conversation about a recent football game, and suddenly your loved one just shifts gears entirely and asks if you've finished your homework. So you answer them, you go right back to your pleasant football chat, and then literally 2 minutes later, they ask again. This right here is the daily skipping record reality that we call conversation looping. And this brilliantly illustrates exactly what we're up against. Dealing with memory loss and the overall impact of the disease ranks right at the very top of caregiving challenges, coming in at 25%. But right alongside major issues like agitation, we see repetitive speech or actions ranking as the primary challenge for 12% of caregivers. Furthermore, just handling the sheer stress of it all and finding the patience to cope rank right behind memory loss. So if you find yourself totally losing your patience when you hear that exact same question for the 30th time before lunch, listen, you are not alone. Your frustration is completely valid. Statistically speaking, it's literally one of the absolute hardest parts of this entire journey. To really get a handle on this, we kind of need to formally define what we're looking at. Conversation looping falls under this broader umbrella of repetitive behaviors, or RBs. Now look, we all repeat ourselves sometimes when we aren't paying attention, right? But as Dr. Ira E. Hyman Jr., who's a professor of psychology, explains, with cognitive impairment, the actual physical work of binding the elements of an experience into a personal memory is completely disrupted. So whether the person is asking a question every 2 minutes, constantly packing and unpacking a purse, or just rhythmically rubbing a table, we have to remember this is an involuntary symptom of mild to moderate dementia. It is not intentional harassment. They literally do not know they just asked you that question. To truly remove the blame and ease that frustration you might be feeling, we have to look at the neurobiology. Like, why does the brain actually do this? Well, the science points straight to the basal ganglia. These are the largest subcortical structures in the human forebrain, and they heavily influence our motor behavior, our emotions, and our cognition. See, our brains have these incredible cortical striatal circuits. Basically, they're just feedback loops that help us select and sequence our actions based on whatever is going on in our environment. But when deterioration happens in these frontal striatal circuits, the brain simply loses its ability to inhibit existing urges. The feedback loop snaps. The patient essentially becomes trapped in a stimulus-driven behavior, totally unable to switch to a new behavioral set. It's basically a mechanical failure of the brain's stop button. Now, what's really interesting about this slide is how these repetitions actually show up totally differently depending on the specific type of dementia a person has. In Alzheimer's disease, about 60% of patients exhibit repetitive behaviors, and it leans heavily toward verbal repetition, repeating questions or telling the same stories. And this is largely driven by that poor recall and episodic amnesia that is so characteristic of Alzheimer's. However, in frontotemporal dementia, or FTD, a staggering 80% of patients exhibit stereotypic behaviors. But here's the wild part. The severity of the repetition here doesn't actually correlate with their memory score. Instead, these compulsions are tied directly to damage and lower energy, or hypometabolism, in the right orbital frontal region of the brain. So the underlying disease literally dictates the flavor of the loop. So the crucial point is this. We know the brain circuits are failing, sure, but the psychological needs of the actual human being sitting right in front of us, those are still very much intact. And this means we have to make an empathy shift. Instead of just groaning internally and thinking, oh my gosh, they already asked me that, we have to train ourselves to take a beat, pause, and ask, okay, what is the question underneath the question? Because people with dementia who ask questions repeatedly are almost always trying to express a specific concern, cope with some kind of internal frustration, or signal a really profound sense of insecurity. Which leads us perfectly to this incredibly powerful guiding principle. The care response should answer the emotion first
and the facts second. This is huge, guys, because short-term memory loss is continuously erasing your factual answers. Trying to use cold, hard logic is just a losing battle. The fact you give them, it's going to vanish in 60 seconds anyway. But the emotion, the fear, the anxiety, the intense boredom, that is going to remain active and totally unresolved. Caregivers absolutely must learn to address that lingering emotional need instead of the facts. Let's play detective with some real-world examples just to see how this works in practice. So say they keep asking what time is dinner. Well, they might not actually care about the physical time on the clock. They might just be hungry, or maybe they're feeling super anxious about their daily routine being off. If they ask, where is my daughter? Giving them a geographical location like she's at work won't help. What they are really saying to you is, I feel lost and I need the safety that my daughter represents. So you provide reassurance. And if they ask, have you finished your homework? They're likely seeking a connection to their past role as a caring parent. You don't correct them, you validate their care. It's a total game changer. So, how do we implement this? Here are some bite-sized, rapid-fire communication adjustments you can literally start making today. First off, keep your answers brief. Long, drawn-out explanations totally overwhelm a declining brain. Maintain eye contact and keep a really calm, soothing tone of voice. Your nonverbal communication is huge here. Use visual aids like big clocks or clear written signs. Sometimes reading an answer actually helps it stick a little better than hearing it. But above all else, do not argue or correct their facts. Trying to force them back into our reality, it only breeds anger. You have to step into their alternate reality. And always, always do a quick mental check. Are they simply in pain, hungry, or tired? Because basic needs so often disguise themselves as repetitive questions. Let's move to and see how this builds into an actual physical strategy for breaking the cycle. Redirecting the loop is essentially a 3-step dance. Step 1, respond calmly and briefly to the repetition. Step 2, address that underlying emotion we talked about with gentle reassurance, maybe a comforting touch. Step 3, distract them by turning the behavior into a purposeful activity. For example, if they're rhythmically and repetitively rubbing their hand across the dining room table, don't just snap and tell them to stop. Hand them a soft cloth and ask if they can help you dust. Boom, you've just validated their physical need to move, addressed their underlying boredom, and redirected them into feeling helpful and connected. And hey, we also cannot ignore the room around us. You absolutely must reduce environmental triggers. Quiet the noise to calm the mind. Environmental factors play a massive, massive role in exacerbating these repetitive behaviors. Think about it, a television blaring the news in the background, a chaotic, overstimulating room, or conversely, a total lack of purposeful activity that results in severe boredom. All of these things are guaranteed to throw a compromised brain into a loop. Honestly, sometimes the very best treatment for a repetitive, disruptive vocalization isn't some new medication. It's literally just turning off the news, putting on some calming music, and altering the room to match the patient's sensory needs. Now, doing all of this day in and day out, it requires a tremendous amount of energy. So we have to talk about you, the caregiver. As Dr. Julie Chandler notes, fatigue is one of the major things that causes caregivers to just hit the end of the rope when it comes to patients. That constant repetition takes a severe, undeniable toll. You have to watch for these normal but completely dangerous warning signs of caregiver stress. Are you experiencing exhaustion and sleeplessness? Are you suddenly crying at minor upsets or snapping at your family members? Are you withdrawing socially and totally giving up your hobbies? Having trouble concentrating? Guys, these are giant flashing red lights telling you that you are heading straight toward burnout. Recognizing those signs is step 1. Taking action is step 2. If you are facing total exhaustion, you must ask family or look into community programs for help. Let's be clear, asking for help is not a sign of inadequate caregiving. It is an absolute necessity. You literally cannot do this alone. If you're paralyzed by anxiety, sit down and start planning for future care and finances so the unknown becomes known. If anger and frustration are boiling over, join a support group. Talking with people who truly understand what it's like to answer the exact same question 50 times a day is incredibly validating. And to combat that social withdrawal, you must fiercely protect your personal hobbies and friendships. Your identity outside of being a caregiver absolutely matters. So as we wrap up this explainer, I really want to leave you with this final provocative thought. We know for a fact the record is going to skip. It's a symptom of a changing brain, right? It's not a flaw in their character or yours. But the next time that record skips, are you going to spend your precious energy fighting the words? Or will you take a deep breath, look beneath the surface, and answer the emotion? When you shift your focus from the cold facts to the underlying feelings, you empower yourself to respond with the kind of grace, patience, and deep connection that both you and your loved one truly deserve.